Hello everyone, welcome to Within the Frame. I'm Kim Bo-kyung. Almost 10,000 junior doctors resigned as of Monday night, which is around 80% of the total trainees at around 100 hospitals. To get them to return to work, the government has set an ultimatum to go back to their places of employment by this Thursday or face legal action. The collective action by the doctors is to protest the Yoon administration's plan to increase the medical school enrollment quota. And the protest is leading to some serious disruptions in medical services, with one patient in her 80s having died after the ambulance crew searched for an hour to find an available emergency room that would take her. What is the fundamental reason behind this collective action, and how should it be dealt with? For this, we have invited Professor Howard Lee from Seoul National University. Professor Lee, welcome.
Thank you for having me.
And we also have Professor Peter Chin-hong at the University of California, San Francisco. Good to have you with us, Professor Chin-hong.
Great being on, Bo-kyung. Thank you.
All right. First question, Professor Lee. I'd like to first ask you how hospitals and doctors' clinics are grappling with disruptions to medical services as trainee doctors extended their walkout. Could you share with us how serious the situation is?
Well, it is very serious, as you may imagine. It's hard to see a doctor because number has all of a sudden decreased. And actually, the number of new patients visiting the general hospitals in the nation have fallen 25%, with the number of surgeries plunging down to 50%, if I'm not seriously mistaken. So many elective or non-emergency surgeries had to be rescheduled. But luckily, the emergency room and intensive care units have been up and running as much normal as possible, thanks to the board-certified physicians, such as professors and fellows, but it won't last forever. But the situation could become worsened in a couple of days. I have several reasons for this concern. Number one, the trained doctors who didn't work off will soon follow those who did, because their training period will expire by the end of this month. They comprise approximately 25% of the total trainee doctors in the nation. The same thing will happen also to the fellows. The fellows are annually recontracted, so by the end of this month, their contract will also expire. And many of them will not stay longer in the hospital. And there is another reason that we have to really worry about. More than 90% of incoming interns have already expressed they will not come to work. So, in a nutshell, the end of this week will be a really critical time. So we do not anticipate what's going to happen next week.
Right, it's quite worrisome indeed. Well, Professor Chin-hong, I wonder how foreign media outlets and doctors abroad are seeing such vacuum in medical services in the country. What's your take on this?
Well, Bo-kyung, I see the merit of both sides. On one hand, there are a lot of patients suffering right now in Korea, and the strategy of increasing medical school admissions is a good one. However, that will bear fruit in many years. On the other hand, the trainees are suffering. I think there is a need for culture change in the hospital setting. There's increased rates of burnout, mental health issues, suicide rates. This is not unique to Korea. It's been seen all over the world in junior doctors. In the United States in 1983, since a teenage patient died due in part to overworked trainee, some of the laws were changed so that there's a restriction on work hours to 80 hours a week. So I think all of this merits attention to both sides, not just one.
Right, I cannot agree more. We need to take a look at both of the sides of the issue. Now, Professor Lee, in response to the departure of doctors, the government raised its 4-scale healthcare service crisis gauge to the highest level of serious on Friday and came up with a variety of measures. Could you tell us more about these measures and how they are effective right now?
Well, the government came up with two emergency measures. Number one is a broader introduction of telemedicine. Telemedicine was allowed only for the high tier hospitals for the non-first outpatient visits only before. But it has been expanded to the low tier hospitals, meaning that all hospitals can use telemedicine in one way or another. However, what matters in this context is seriously ill patients and emergency patients. And for those kind of patients, I don't think there is not many, if not none, telemedicine can do. The second option, second policy that the government came up with is to open public health centers and military hospitals. But I don't think it has been as effective as expected either.
All right, I see. So two main solutions to this was to expand the telemedicine and also open up the public health centers. But among measures the government came up with is actually having physician assistants take over some of the duties of doctors as well. And Professor Chin-Ho, though there is no separate license under the current Medical Service Act, the government decided to let them temporarily carry out these duties starting Tuesday. Do other countries have such licenses?
Yes, they do, Pokyung. So certainly in Canada, UK, other countries, there are licenses for advanced practice providers, as they're called, including nurse practitioners and physician assistants or associates. In the United States, some states even allow autonomy to these advanced practice providers starting in 1988. In Alaska, due in part to some areas not having enough physicians due to the increased need for physicians. In California, where I live, there's no full practice autonomy. Usually, advanced practice providers work in teams with physicians who are licensed, and they work as a group. But there is a movement, and in a couple of years or so, we expect to also follow. Right now in the United States, about 25% of all care is covered by these advanced practice providers like physician assistants, which is striking, primarily in primary care and psychiatry, less in some other areas.
All right, I see. Thank you for your explanation, Professor Chin-Ho. Professor Lee, we have discussed how the situation is unfolding and how the government is trying to deal with it. But let's get to the basic question. Originally, doctors, as far as I know, partly agreed to increase the number of doctors, and the Yoon administration had also prepared some appeasement plans for the medical community. But as we all know, almost 10,000 junior doctors are participating in collective action. What is the fundamental reason behind this walkout?
Well, I think that's $1 million question. But let me correct this first. You have said doctors partly agreed to increase the number of doctors, but I would say that's the biggest miscommunication or, if you will, confusion. The government asked the deans of medical schools how much more students would they want to have, would they want to have as incoming students. The government did not ask if the medical schools could handle that many students. Of course, the university, particularly the president or someone who is quite responsible for this kind of matter, love to have more students assigned to them because it will bring them more tuition, more money, more support from the government. So in some sense, they were misguided, and some sort of conflict of interest was played out in this context. Turning back to the trainee doctors, I'm trying to answer your question. They didn't see any future hope in the way that the government treated both of them and the medical community. The trainee doctors asked, why are we being treated as villains after dedicating our time and energy into saving people's lives for many years? Not only that, they think the government plan does not reflect the reality. For example, the government said they would increase support for the for the essential medical disciplines such as pediatrics, emergency medicine, and neurosurgery by setting aside $7 billion for 5 years. But that is only less than 2% of the total healthcare cost in Korea. It's too little, and the plan is lacking the required details.
Right, I see. So there was huge miscommunication between the government and the school. And also, the trainee doctors are quite unhappy about how they are being viewed as villains regarding this issue.
Unfortunately.
Right, I see. Professor Lee, one more question. So the government set a deadline for trainee doctors to return to work by Thursday, as I have mentioned before, saying it will not hold them accountable. And if they don't, they will face legal action, such as possible suspensions or revocations of medical licenses. How does the medical community see such a measure, and will this be able to persuade them?
Well, the medical community certainly sees this a big blackmailing, not only to the community, but to the public as well. You know what? We live in a free country, and President Yoon himself is the one who highly valued the value of freedom, as we all heard in his inaugural speech. No one can enforce anybody to do this or that. Trainee doctors are not an exception. They are not striking. Instead, they walked off to the hospital in frustration and disappointment by submitting resignation letters on their free will. But the government literally threatened the trainee doctors to suspend or even revoke their medical licenses, which I'm not a legal person, so I consulted with veteran lawyers on this matter. Many of them pointed out that it could be unconstitutional. No, the ultimatum made by the government will not succeed in persuading the trainee doctors to come back to where they used to work.
Right, I see. Professor Lee, I'd like to ask you this additional question, since we have talked about how, the doctors are seeing government's decision to basically take legal actions against them. You see, there is also public opinion that the doctors are holding the patients as hostages. How are medical community seeing this kind of view from the public?
Well, the medical community sees the other way around. In other words, the government takes the patients hostage in order to, move on. Implement what they have devised a long time before this kind of thing has happened. So, both parties are quite strong. Nobody wants to recede. Just one step back. No one wants to do that. So that's why we are stuck in the middle.
Right, I see your point. Well, Professor Chin Hong, given that South Korea is not the only country suffering from an aging population and low fertility rate, there must be other countries that are dealing with doctor shortages. Could you share cases from other countries?
Yes, definitely. The US, for example, the number of new medical school slots for training physicians is only expected to increase by about 5% or less by 2030, in contrast to some of the physician associates or advanced practice providers that are going to go up by as much as 50 to 80% by 2030. So there are a lot of factors, which includes, like Korea, an aging population, not training enough physicians, like I mentioned, but also other factors as well. There's a cap on residency training spots or junior training spots that needs to be lifted. Also, there's a maldistribution in urban areas versus rural areas, like many parts of the world, like Australia, Brazil, where they've had to give incentives for people to move to these areas. Finally, of course, like Korea, there's a maldistribution in specialties, with more people now recently going to higher paying specialties like radiology or dermatology, and not enough primary care specialties. And there's one other factor too. In 2010, there was Obamacare which gave a lot more Americans health insurance. We don't have a national health system like Korea. And that also increased the need for having more clinicians.
Well, since you have shared some of the cases at abroad that is going through the doctor shortages, sometimes, in my opinion, it's better to refer to those cases overseas. So are there any examples of countries that were able to solve this shortage of doctors well without any hiccups?
No, I don't think there are really success cases. I think the whole world is really grappling with two situations. On one end, you have a tradition of overworking junior doctors, which I think needs to be changed because they are still learners, they are still students in some senses. And you also have an aging population. People have tried various strategies, like giving incentives, as I had mentioned, but, training and providing licenses to these advanced practice providers is a strategy that people are increasingly turning towards because it is more efficient to train some of these individuals. And some data suggests that outcomes, particularly in primary care, psychiatry, are equivalent to physicians, not other areas, of course. And not only these physician associates we're talking about, but during COVID, we learned that giving pharmacists license to provide prescriptions, for example, for Paxlovid, was a success. So I think this is the movement that's probably going to continue.
All right, I see. Well, this really seems like a challenging issue to tackle with. Professor Lee, I'd like to ask what's going to happen if the government does increase the number of students like they said. The Education Ministry has reportedly asked medical schools to finalize the increased enrollment quota number in line with the admissions increase of 2,000. The government has vowed to provide support for high-quality medical education and training environments in schools. But how do you see some of the policies the government brought up for this issue?
Well, I don't think any medical school in South Korea can handle this huge increase in the number of incoming students by almost 70%. The government, to me, does not seem to understand or even ignore the unique factor that education and training in the medical school is far away from the traditional didactic or classroom-only teaching. They need more equipment, more experiment rooms, more cadavers for anatomy lab, for example, more hospitals and more professors, more teachers, I mean. But none has been ready to my perspective. And the government has not disclosed how they could overcome those issues. So it's a big concern. I mean, as a faculty person affiliated with the hospital and medical school, myself, I think this is really worrisome.
Right. I cannot agree more. Well, I'd like to ask this last question to both of our experts quite briefly. Rising tensions between the government and the medical community definitely need to be dealt with as soon as possible so that no more patients suffer from a lack of medical services in the country. So, Professor Chin Hong, in what way should the issue be solved?
Well, I think it's a fundamental human issue of dialogue. I think both the junior doctors and the government have to find common ground. The mission is aligned. Everyone is really aligned in the fact that we have to take care of the population. We have to take care of sick people. But I think there is merit on both sides. But again, like I mentioned, Korea is not unique in having a very historical aspect of overworking junior physicians. And I think that really needs to be changed. So I think coming around the table, having some dialogue, having some compromise, having people respect each other's expertise and having both sides participate in policy is probably the way forward.
Right, dialogue would be the key. Professor Lee, may I ask your opinion as well?
Well, my answer is simple. We need a mediator who is politically and diplomatically savvy, who can connect both parties. Currently, the battle between the government and the medical society is left just with them, but that's not a good thing. We need somebody who can connect both parties and then can listen and then translate that into something that the other party can understand. And I think that's what we desperately need at this point in South Korea.
Right, we need a mediator. All right,
Yeah.
Thank you for your advice, Professor Lee. Now, unfortunately, this is all the time we have for today's edition. Thank you, Professor Lee and Professor Chin Hong, for your time and insights today. We really appreciate it.
My pleasure. Thank you.
Thank you.
Thank you. All right, that's all for Within the Frame tonight. Thank you for watching, and goodbye.